Devotees of Obamacare will tell anyone who listens, and at the loudest level possible, that the Affordable Care Act is the right thing to do, that it makes life easier for all, and that without it, families may be forced into crushing debt. What they won't tell you are factual stories of those who are already feeling the weight of a poorly designed law, regulations that could drive a family to bankruptcy and children to a hard fate. Let's welcome to MidPoint. She is the mother of two chronically ill children living in North Carolina, also founder of Schwackman Diamond America, a nonprofit research and educational organization related to the condition her children suffer from. It is a pleasure to welcome Pattie Curran into the show. Pattie, thank you so much for being here.
Thank you for having me.
Pattie, please, if you will, just set up, first of all, the situation with your children and the disease that they suffer from, and tell us how that then impacted and why Obamacare is hurting that. But let's first find out about your children.
Well, I have two children who have Schwackman Diamond syndrome, which is a genetic bone marrow failure syndrome, and they have secondary mitochondrial disease, which is a neuromuscular disease. And Obamacare has gravely harmed my family by increasing our premiums, our co-pays, our out-of-pocket maxes. And as of September 15th, the medications, life medications that treat their mitochondrial disease are no longer covered by their insurance.
Let's go back now to the moment where you changed insurance. Could you tell us exactly how that happened, why you did, a little bit of the procedure here as to how you got involved then in the Obamacare?
Well, we actually have private insurance, which is also regulated by Obamacare. Obamacare is more than just the exchanges. It mandates and regulates all insurance across the board. So we've had the same insurance since 2005, but our employer has sent out letters last year, and again this year we're finding out that their costs are increasing $7.4 million because of the law, and those costs are being passed on to us as well. They're eating some of the costs, but we're also taking in, a burden of that cost. So we don't have necessarily an ACA plan, but our current plan has changed because of Obamacare, loss in coverage of life-saving medications and cost increases.
Knowing the conditions that your children suffer from, knowing the medications you would need and the treatments, when you first saw Obamacare and when you started to see the Affordable Health Care Act and how it would impact you, were you a little suspicious in the first place and tried to raise some red flags?
Oh, absolutely. In 2010, I confronted Senator Kay Hagan on camera, and she told me that Obamacare would give us the same health insurance that they are afforded in Congress.
Okay,
and
she said the same insurance as they
lie.
afforded. Wait a minute, she said the same insurance that she's afforded in Congress. Did she tell you that your coverage wouldn't change? Did she tell you that things would be taken care of at the rate that you expected?
She made it sound like it was going to be all roses. You can find the video of me confronting her and where she says that it gives us the same health care that they're afforded in Congress, and we knew that it was a lie. But so I've been speaking out. I have gone and visited every single senator and representative in D.C. Last year, I brought them copies of invoices showing that one of the life-saving medications that protect my son's kidneys from damage, the copay had gone up to $532. And I brought invoices that we had paid, brought that to every single one of them. They really don't care. I've protested in front of the Capitol and in front of the White House, and trying to make my voice be heard, because we knew this was coming, and we just got information about next year, and we're quite distraught because we don't know how our family is going to handle these new changes.
Pattie, did you have any alternatives in insurance whatsoever? Because I guarantee you that people will be saying, wait a minute, there must be another insurance company. There must be another way for you to be able to get these medications covered.
Well, we really don't have an option, because those of us who have employer-based benefits are not eligible for the subsidies, in which case, if we go to the exchanges, which I've looked at, one of the plans on the ACA exchange would be $1,776. I call it the freedom plan, the freedom to die plan, because after you pay $1,776 for premiums in a month, you can't afford to eat, correct? So I've looked at these plans. Our children's doctors are not all on the plans, and they actually cost more and cover less. So we're fortunate that we still have employer benefits, because we're able to go to places like Cincinnati Children's, where I just spent the last week with my youngest son. We're afraid that we will lose access if we're dumped to the exchanges.
When you say the freedom to die plan, it sounds to me as if that you, as a mother looking at two ill children, that you sometimes might feel that your government has not only let you down, but perhaps they are certainly willing to let your kids die and not give them the amount of coverage and the things that they need to live.
Oh, absolutely. The only thing that the left will is will look who is being helped. And I try to come back with, so my children can die. My children's life-saving medications can be denied as long as other people are being helped. That's eugenics right there. My children deserve to have the best care. And we're not asking for government handouts. Like I tell people, I want the government to stop stealing my lunch money so that we can buy our own lunch. We want to afford our own children's health care, and it was more affordable before Obamacare, and now we can't afford it. Next year, we just got the benefits. We're going to have a $5,700 out-of-pocket max for medication copays on top of our $7,500 out-of-pocket max for medical, and that's really gonna harm our family.
I only have about a minute or so left. How desperate is your economic situation right now, and the health of your children as well?
Right now, our financial situation is grim. We are day to day trying to do what we can, and as we look forward to the future, we don't know how we are going to manage. My children are doing fairly well. We continue to see doctors regularly.
Do me a favor here. Look into the camera, look into the eyes of Kay Hagan and also Barack Obama. And in a few seconds here, try to tell them what you're going through right now and how bad this plan has made your life.
It's made our lives miserable, unaffordable. Think about your children and not having access to their life-saving medications. Our doctor wrote a letter to the insurance to appeal stating that my children could die if these medications are denied. And I'd like for Kay Hagan and Barack Obama to look at their children and have some compassion, empathy for me as a mother, and to repeal this law and change it back.
The organization, again, is Schwackman Diamond America. It's nonprofit, and Pattie Curran is the one who founded it and also works every day to make sure that her children are able to get the medications that they need. But just another story of one who is fighting the Affordable Health Care Act every single day. Pattie, thank you so much for your time. We wish you and your family the best of luck, and I hope the next time we speak, it's under better circumstances.
Thank you.
All right. We'll continue right after this on MidPoint, the show that every day questions everything.